AAMG is dedicated to provide the highest quality multi-specialty medical services to patients in the San Francisco Bay Area. Come sign up to be a member today. AAMG. Your choice, your health, our mission.
Now, we'll talk about obesity. Now, of course, if you don't have a healthy diet, it might increase the risk of obesity. Of course, exercise is also important too. So obesity can affect asthma adversely in two basic mechanisms. One is mechanical, one is immunological. Mechanical is basically if you have obese, your lower abdomen will be big and it will impair airflow into the lung. And if you're already compromised with asthma, it will make the asthma symptom much worse. The other mechanism is that fat tissue can also produce a mediator that can cause more inflammation in the lung. So preventing obesity is also an important way that we don't want the patient to be obese in order to control the asthma better. Of course, if you're allergic to certain food, you might have to avoid the food that you're allergic to because that can aggravate asthma. And a lot of time you have to do testing to find out exactly what food you're allergic to. This slide shows the healthy diet. Of course, vegetable, fruit, eating those will reduce the chance of obesity. These are the example of common food. Food rich in vitamin D, I think is important, especially milk. So if you can tolerate milk, drinking milk will help to reduce the chance of vitamin D deficiency. If you have low vitamin D, most of the time the asthma medication might not, the inhaled steroids in particular might not work as well. Of course, food that are not healthy, high fat, can increase the chance of obesity, and this food should be avoided if possible. This slide shows the common food allergens. So this is because the patient is allergic to the food. When they ingest that can cause allergic reactions, sometimes asthma, sometimes anaphylaxis. The most common food allergens in children are milk, egg, wheat, and soy. I mentioned that milk with vitamin D is helpful for the patient to prevent vitamin D deficiency. However, if the kid is allergic to milk, drinking it might aggravate asthma or worse, anaphylaxis. To find out whether the patient is allergic to that, skin testing or blood test is necessary to prove the allergies together with history. Other food allergy include shellfish, fish, or nut, and that can be present in children and also in adults. Again, skin testing and laboratory tests might be required to confirm the diagnosis. Frequently, patient they will have some skin manifestation like hive or eczema as a clue to make the physician suspect food allergy as a cause for the condition. Now, sulfite is a preservative that can also aggravate asthma. It can be present in wine, alcohol, and also processed food. And this sulfide, when it enters the stomach, it will turn into a gas called sulfur dioxide that ascends into through the esophagus, the eating pipe, and then the patient can inhale it to the lung, causing bronchospasm. So if the patient reacts easily to the medication, that also gives me information because that means the airway is too inflamed. So I might elect to treat it so that it won't react that easily with sulfite. Of course, if you can minimize sulfite ingestion, that also reduces risk of exacerbation of your asthma. So this slide shows how to avoid, if you're allergic to certain food like nut, or meal, egg, what you need to do, you need to read the label carefully so you won't ingest the food that you're allergic to. When you go out to eat, you have to inform the waiter, the waitress that you're allergic to the food, so it won't be, that your dish will not be cross-contaminated with the food that you are allergic to. So that is important to prevent exacerbation of your food allergies. So in addition to avoiding food, the other treatment that I want to re-emphasize again is that it is important that you carry a fast-acting reliever, the albuterol, and keep it with you at all time because asthma attack can happen anytime. You don't have the inhaler available, the quick reliever, the consequence can be serious. And asthma can suffocate you, it can cause death. So always carry an inhaler with you, a bronchodilator, the albuterol. Now, if you need to use it frequently, then you have to contact your your physician, because you need to have additional medication so that you are not overly dependent on it. And you remember, this is the quick reliever is a medication for emergency. If you use it all the time, then it will stop working. Then you get into quick trouble. So you have to utilize a few long-term preventive medication to prevent the attack. So as always, consult your doctor to make sure that the symptom that you have is actually asthma, is not something else, and that the treatment is appropriate. Identify what you're allergic to, whether you're using the medication correctly, and they're all important. So consult your physician for the treatment. Work with your physician for the treatment. And that will conclude my talk, and I will welcome any question that you might have for me. Thank you.
For more information on other health topics, please visit the AAMG Health Education website. If you like this video, please give a like, and subscribe to our channel for more related content.